If you're wondering whether or not you should freeze your eggs or if you're thinking about having kids now or in the future, this episode is a must listen.
So your peak eggs are actually when you're 24. Stop putting it off. Look after your reproductive health from an early age.
I'm 10 years too late.
No, you're not too late. So whatever we do in our 20s can affect our eggs in our 30s, and whatever we do in our 30s can affect our eggs in our 40s. You're not sick when you're trying to have a baby. It's not an illness.
Not only do you create life and you're one of the smartest people I've ever met, you have the talent for wearing the biggest shoes I may have ever seen. This is Fernwood Unfiltered, the podcast for straight up, expert-backed advice for women's health and fitness. And the discussion today is one that I am very interested in, whether you're in your 20s, your 30s, your 40s. If you're wondering whether or not you should freeze your eggs or if you're thinking about having kids now or in the future, this episode is a must listen. And I'm thrilled that we have one of the leading voices and expertise in this field, Dr. Lynn Burmeister, with us. Dr. Lynn is a highly respected fertility specialist, obstetrician and gynecologist with more than 20 years of experience. She holds the highest qualification in fertility medicine and trained internationally at the world-renowned Cornell University. Through her clinics around Melbourne and Sydney, Dr. Lynn and her team are helping women and couples take control of their fertility journey with insight, compassion, and leading care. Dr. Lynn, welcome to Fernwood Unfiltered.
Thank you, Georgie.
Dr. Lynn, for the woman listening to this podcast, what do you hope they take away from the chat that we're about to have?
Really, I want them to look after their future fertility. I want them to look after their egg health and know that their eggs will start to decline in quality even after their 24th birthday. So whatever we do in our 20s can affect our eggs in our 30s, and whatever we do in our 30s can affect our eggs in our 40s. So I want everyone to take away that you can protect your fertility future by looking after yourself in your 20s and early 30s.
How does your fertility change from 20s to 30s to 40s?
Yeah, so your peak eggs are actually when you're 24. That's when you're the most fertile in your life. And by the time you're 30, you've got about 10% of your eggs left. By the time you're 40, you've only got about 2% left. And what happens as we get older, the chromosomes in the egg start to jumble. And that even happens after your 30th birthday, but more dramatically after 35. So, and then after 40, there's a lot of jumble in your chromosomes, and about 70% of your eggs in your 40s will be abnormal. So ideally, if you're going to do things like egg freezing, you want to do that in your late 20s or even between 30 and 35.
Tell me, you can say this to me straight. I'm not going to be offended. I won't. I will try not to burst into tears. But as someone who is 34 years of age, I've never really thought about my fertility or anything. I'm thinking I want to have a family, but I don't know. I've never done a fertility health check. I'm not exactly sure how my literacy is nowhere where it needs to be. Would you say that I am a candidate for having strong chances of fertility, of good fertility?
Yeah, I think if you've kept yourself healthy in your 20s and 30s and looked after yourself by exercise, diet, good nutrition, vitamins, I think your fertility should be fine. But we do know in your 30s, the eggs will start having 30% of them will start having chromosome issues. So 70% will be okay, but now we're up to about 30% that won't be okay.
So when it comes to us talking about eggs and then using those to then create children, how does that work at the most basic level?
Yeah, so when you're using your eggs to create children, you've got to ovulate, and then the sperm's got to hit that egg on that day. So the egg can only be fertilized for 24 hours. So it's a really short time in that month that you'll get pregnant. And the pregnancy rate for humans isn't that good. So each month you've got about a 20% chance when you first start off to have a baby. So that's why we usually say try for about 6 months if everything is normal. But if you haven't got pregnant after about 6 months, you come along to a fertility doctor like me so that we can assess everything out and make sure that everything's normal, make sure you're ovulating, your partner's got sperm and things like that.
Let's talk more about that, because when you say normal in terms of your fertility, what are the signs? How do we know?
We want to make sure you're ovulating. So if you have irregular periods, that might mean that you're not ovulating. If you have painful periods, that might mean that you've got endometriosis. So if you've got something like irregular periods, painful periods, or you're getting hot flushes, that might indicate menopause, we want to see you earlier. So we don't want you to wait 6 months.
So when is the best time to start thinking about your fertility?
When you're 24.
Oh.
Yeah. So
I'm 10 years too late.
No, you're not too late. No. But I think in your 20s, if we could go back in time, get your egg bank tested in your 20s. So my daughter's 26, so all her friends have tested their egg bank. And some have come back low, some have come back high. The low ones we're keeping monitoring. The high ones we're fine. They can go until they're 30, 35. And if they're not with a partner, then we might suggest egg freezing. But I think in your 20s, you need to start thinking about, maybe I should just get my egg bank tested, which is a simple AMH test.
What are most women's reaction when you say that, 24 is the perfect age? Is it similar to mine where we're like, huh?
Yeah, everyone's very, very shocked. But we think about our grandparents' days. There wasn't anything like IVF back then, but they all got pregnant, or most of them got pregnant very, very easily without drama. But because we're having babies to our 30s, there are more problems having babies.
What kinds of things can affect your fertility?
So a very common condition is endometriosis, which tends to get worse as we're getting older. So 1 in 7 women suffer endometriosis. And some girls actually have silent endometriosis that they don't even know they've got it. And they might come to see me because they've been struggling to get pregnant. And I do what we call a telescope in through their belly button and see that they're covered in endometriosis, which is stopping them from getting pregnant. So that's one of the most common conditions we see. The other common condition we see is polycystic ovary syndrome, where girls have trouble with their weight. They go on all these diets and exercise. They still can't lose weight. They've often got acne, hair growing on their face, and that's a very common cause of infertility as well.
Wow. What are the signs of endometriosis for people who might be listening like, I might have that, I don't know, what is it?
It comes in all shapes and forms. So it can be period pain. It can be pain with intercourse. It can be heavy periods. So some people get really heavy periods, like they're staining their periods. Bloating. You might just get bloating when you eat your meals. Bowel changes, like during your month, like you might get diarrhea and things like that at the time of your period. That's often a sign. And some people just don't even have any symptoms at all, but definitely can cause a lot of destruction in the pelvis if not picked up early and treated.
Do you think that has it been your experience with some of your patients that they just put things off so much because they just think, that's just me, that's just normal, that's how I am, and they just ignore until they start to have problems with their fertility and they come to you to
and I
find
think
this
a lot
out.
of patients will go to their GPs and say, I've got period pain, and the GPs go, oh, well, that's normal. And then they just write a script for the pill and give them the pill. So without investigating, without even doing an ultrasound, without checking their egg bank, and just easily script, here's the pill, take that. And really, someone coming in with period pain mostly or almost mostly will have endometriosis. So they should be investigated first before you just write that script out for the pill.
Let's talk about the pill. Does birth control affect your fertility, or is that something that's a bit of a misconception?
That is a misconception. So some people think that if they go on the pill, they're actually hibernating their eggs and they'll have more eggs when they stop the pill, but that's not the truth. Our eggs are constantly undergoing what we call atresia. So atresia is where our eggs are dying. And even when we go on the pill, they're constantly dying. So the pill doesn't stop your eggs dying, unfortunately. Science hasn't worked out a way to stop the eggs dying or stop the eggs declining in quality. So the pill won't stop that. What the pill will do, though, it helps prevent things like endometriosis. It does help prevent ovarian cysts that could cause problems with getting pregnant. So it is a little bit of a protective thing for your fertility, but also sometimes it can mask things that are going on inside. So it can mask endometriosis. It can mask even if you're going into menopause, and it can mask whether you're even ovulating or not. So it masks all those things. So you really don't know. And some girls are on the pill from their 16th birthday, come off it to have a baby at 26 and come and see me because they haven't had a period. And then we find that they've got polycystic ovaries, sometimes endometriosis. So those things have been masked because that person's been on the pill for 10 years.
How common is that?
1 in 10 women have polycystic ovaries. 1 in 7 women have endometriosis. So the pill will mask those things.
When should you come off the pill if you're wanting to try, or birth control, if you're wanting to try and start having a baby?
Well, evidence suggests coming off the pill straight away and having intercourse the following month, you're fertile already.
Really?
So you don't have to wait a long time off the pill to become fertile. It's just whether you come off the pill and your periods are going to be regular. And if they're not regular, they should be regular by 3 months. And if they're not, you need to see your doctor and potentially a fertility specialist like me.
So I went to the doctor probably last year, around about this time last year. And I asked about whether or not I should be getting a fertility check. You know, not necessarily wanting a kid right now, but in the future, I think that I do. I'm getting up towards 35. And their advice to me was maybe wait until you are ready and you do start trying, because it may not be worth the mental side effects of the stress involved if there is something wrong, or thinking that there could be something wrong, unless maybe just let's see if there's something wrong and then you can worry. Is that sound advice?
I don't like that approach. I like to be more proactive. I'd rather my patient find out that they've got a low egg bank and do something about it than find out that their egg bank is even lower and they've left it too late to do something about it.
And that's a simple process.
That's a very simple process. It's really just a blood test. So it's the anti-Mullerian hormone, which is secreted by your little follicles that you can't see in the ovary, so your little tiny primordial eggs, like your little baby eggs, and they're secreting anti-Mullerian hormone all the time. So, and that gives us a gauge where your egg bank is. So it's either really high or really low. So that's a really good way to start.
What are some of the biggest misconceptions, do you think, when it comes to fertility?
Well, I think people have the misconception that IVF will fix everything. So I'm just going to wait till I'm 40 and then I'm going to see someone like Dr. Lynn and she'll get me pregnant. Unfortunately, that doesn't happen. And because of our egg quality and our quantity has declined by that age. And by 40, about 70% of our eggs have chromosome problems. So that increases your risk of Down syndrome and miscarriages, and also the chance that the IVF won't work.
When you're saying this, I wish I had this conversation 10 years ago.
Yeah.
Well, probably almost longer.
Yeah, that's
longer ago.
I think that we need to have awareness in the schools about girls checking their reproductive health early. Like, don't ignore your period pain. Don't ignore your bloating. Don't ignore your heavy period. Don't ignore that you're starting to get acne and not getting your period, because something is wrong from a hormonal perspective.
What about the male side of things? Does your partner's age affect fertility?
Not really. As men get older, they do have slightly increased aneuploidy, which means abnormal chromosomes in their sperm, but not as dramatic as women. So yes, it does age does affect the sperm a little bit, but often we see a lowering of their concentration of sperm. Maybe their motility is a bit lower because as they're getting older, they sit down more, they don't exercise as much. And we know sitting down does lower the sperm motility. And so it depends on their health as they're getting older as well. So, but yeah, just a slight decrease for men, but not as much as women.
These are all the conversations I really needed to have when I was growing up. We're going to take a really quick break and come back with all you need to know about egg freezing. When it comes to the blood test to check your fertility, your egg count.
Yep, your AMH.
My AMH.
Egg bank.
Do I need to not be on birth control when I have that test? Do I need to have come off it for a certain amount of time?
So what the birth control does is it puts everything in hibernation. So your uterus shrinks, your ovary shrinks, and those little primordial follicles sort of go to sleep. So when we check your AMH, it is always lower. Sometimes it can be really markedly low, but sometimes it's only lowered by about 30%. So I don't advise people to come off it to do the test. However, if it does come back low, they have an appointment with me to discuss the safety of coming off the pill and what they're going to do for contraception. And then we check their AMH in 3 months when they're off the pill.
Okay. So there is a lot of time.
Yes.
And effort that goes into a lot, I'm assuming, all fertility procedures.
There is, yes, there is. There's a lot of preparation because remember, we know that eggs take 90 days to be created.
So you say that we know. I don't know. So it takes 90 days for an egg.
Yeah, for an egg to be created.
Wow.
From its little primordial stage to a mature egg. So 3 months ago, you started creating the batch of eggs you have now.
Really?
Yeah. So whatever you've done in the last 90 days will affect your eggs now. So excessive coffee, excessive alcohol, smoking cigarettes, party drugs, they're all going to affect the eggs that we get in 90 days.
Really? Oh, my goodness.
So if I see a patient, say, for egg freezing or in even IVF, I tell them I want Olympic athletes at the end of 90 days. I want the Olympic egg at the end and the Olympic sperm. So I always give my patients lectures about how I want them to prepare their body for either egg freezing or IVF.
Should I be monitoring my periods like day for day for day, so know exactly when it's coming, what day I'm at, where I'm at in my cycle?
Definitely, because if your periods are irregular, that might indicate you've got something wrong.
Mm.
You could have underlying polycystic ovaries, or you could be running low on your eggs, and that's why your periods have become very irregular. Also, sometimes when your periods get really short together, that is a sign that your egg bank is low because you're churning through those eggs more quickly. So I think everyone should, the apps are easy. Just pop your period down in your phone and have a look at that and just check that your period is fairly regular. Anything over 35 days should set some alarm bells, and any cycle under 25 days should set some alarm bells too.
Really? How long should a typical period go for?
Well, we always talk about the 28-day cycle, but only 15% of women have a 28-day cycle, the perfect cycle. So most of us have cycles anywhere between 25 and 35, and that's perfectly normal.
Okay. I need to be doing a lot more upkeep in my my knowledge about my own body.
Phone.
Yeah, my phone, and use the tools that are available to me. Egg freezing. What is it?
So egg freezing is a process where we actually collect your eggs and freeze them, but it is a bit of preparation. So 90 days, we want the perfect egg. So I prepare my patients with vitamins. So folic acid is one of the ones that's very important for your egg quality, and coenzyme Q10 is another very good supplement for your egg quality. And we also give our patients melatonin. Melatonin is a very strong antioxidant. And if you take it at night time before you go to sleep, it helps you sleep. So there you go. Sleep is important for your egg quality as well. And we know that it works on your eggs as a very strong antioxidant. And it's also anti-aging as well. So
really?
Yeah, melatonin is anti-aging. Yeah.
It's lots of benefits.
Yeah, lots of benefits to melatonin. So I prepare my patients with folic acid, coenzyme, and melatonin for 3 months before they start egg freezing. And then usually they've had a nurse appointment. If they need counselling to get them through the process, we offer counselling as well. And then they ring us up on day 1 of their period. They start the needles on day 2. So sadly, we don't have a tablet for egg freezing yet. So they do have to take needles every day. But they are tiny little EpiPens, so they're tiny little needles, and most patients can do their own needles at home. And then by about 10 days, the eggs are ready. So instead of just having one big circle, which is your dominant follicle, the ovaries often have 10 big circles in them each. So we do the scan and go, yep, that looks great. You're going to have a great result. And then we give the patient what we call a trigger injection that matures the eggs and would make them ovulate. But before they ovulate, we go in and collect them through the vagina under ultrasound guidance with a light sedation anesthetic, so it's not painful, and we collect all the eggs through the vagina. Very simple process. Very rare to have any complications from egg freezing.
What are you injecting yourself with?
You're injecting yourself with follicle-stimulating hormone, which is what you produce to make 1 egg a month. So we're just replicating that but giving you higher doses so we get more than 1 egg a month growing.
Does it hurt?
The needles don't hurt. They're just tiny little EpiPens. The egg collection, because you're asleep, you won't feel that. But when you wake up, you might have a bit of period pain for about 24 hours.
Okay. So it's an invasive but not super invasive procedure?
Yeah. Most people are recovered within 5 days of the procedure. They have their period. They're back at work the next day. It's if they get lots of eggs, like if you're a patient that gets over 30 eggs, you might be struggling with bloating and feeling uncomfortable, but not many people get over 30 eggs.
How many eggs do people usually get?
On average, it's between 8 to 15.
What's a good number?
20.
20.
20 is the one that we're all aiming for. That's what we want our patients to get, because that, if you're under 35, that will give you a 95% chance of 1 baby.
Wow.
Yeah.
Really?
So it's really good. And some people want to freeze more. I've had a patient froze 55 eggs because she wanted to have 2 or 3 babies from those eggs. So we do have graphs to show patients about how many eggs you need for 1 baby, 2 babies, 3 babies.
What are the many reasons, or what are some of the reasons that people decide to freeze their eggs? What are the driving factors, do you think, of your patients, the most common ones?
Well, the most common is that they're single and they don't have a partner and they're not in the place to be able to have a baby. They're not ready for donor sperm. They really ideally want to meet someone have a baby with, but they haven't met anyone, or they've been in long relationships and they've split up and they come in and egg freeze because they thought they were going to marry that guy and they've split up and they come to see me for egg freezing. So that's the most common. So the second most common reason is a medical problem. So you might be diagnosed with endometriosis and the doctor's got to take you to surgery to cut the endometriosis out. And that can damage your fertility and your AMH. So before they go into surgery, we would recommend that they egg freeze. So a medical reason, or if they've been diagnosed with cancer and they have to have chemotherapy, that's another medical reason. And the third reason that I see is people that are career people and they want to have these amazing careers. I think the youngest eggs I've frozen from a career person, she was 25. She was a lawyer. I tried to convince her out of egg freezing. She goes, no, I want to be a partner in my law firm and that's going to take me until I'm about 38 to get there. And I won't be able to have children on my pathway. So I want to freeze my eggs now when they're at their peak.
Wow.
So she froze 30 eggs. So we've got them stored.
My God.
Yep.
Well, I needed to be her.
Yeah.
When you have the eggs, you've retrieved the eggs, how long do they survive for? That's probably a really dumb question.
No. So they don't go off like peas in your fridge or meat in your fridge. We don't have to throw them out every 5 years or 2 years.
Yeah, do a recollection or something.
No. They're frozen. So what happens is they're cryoprotected before we freeze them. And then we snap freeze them to minus 196 degrees Celsius. So they're sort of frozen in time. They don't go off. So a fresh and a frozen egg give us the same pregnancy rate now. So we could freeze those eggs for 100 years. We could actually freeze those eggs for 200 years as long as the clinic's still looking after them. But there are rules in Victoria and Australia that we have to have time frames for people when they can freeze their eggs up into. So currently it's 5 years and then we just reapply for an extension. And then 10 years we have to reapply again. And then usually by about 15 years, most people have decided what they're going to do with their eggs.
This is why it's becoming so much more obvious to me now. It's why your egg health is so important. Because as you said, if you've got a frozen egg and a live egg, it's the same probability
exactly.
that it could work?
The technology is so good now that the frozen egg and the fresh egg give us the same pregnancy rate. So if I have a 41-year-old patient doing IVF and we're trying to get her pregnant with her 41-year-old fresh eggs, and I compare her to a 41-year-old that froze her eggs at 34, the 41-year-old with the frozen eggs at 34 is much more likely to end up with a baby than the 41-year-old with her fresh eggs.
If nothing goes wrong, everything is seamless and it's all perfect. Having frozen your eggs and then deciding whether or not you're ready to use them and go through IVF, how long is that process?
So once you've decided who's going to be the man of your dreams or you want to use donor sperm, we actually put you on a program linking you up to your menstrual cycle. So on the day you ovulate, we pull those eggs out of the freezer and we fertilize them all on that day. And then 5 days later, we put the embryo in. So it's really just like a menstrual cycle. So you'll know whether you're pregnant 10 days after the embryo goes in. It's really quick.
Really? Wow.
Yeah.
That to me, it shouldn't be so surprising, but I just,
So that part is the easy part. The harder part is putting them in the freezer.
How do you cope with the emotional side of this? So the emotional side of your patients, because you say it takes them 3 months to prepare if they're going to go through an egg retrieval process and they're going to freeze their eggs. You say part of that potentially could be some counselling with what they're going through. How does it affect them?
I think most girls that go into that egg freezing journey feel really empowered and they feel great about what they've decided. So at that point, we deal with heightened emotions so that everyone's like, yes, I'm going to do it. I'm going to do something great for myself. I've had bad relationships. I'm going to show everyone I'm going to get 20 eggs. And again, not many people get 20 eggs, so I have to adjust their expectations. But it's after the egg collection, sometimes they will crash because sometimes they'll realize, really, I want to get married or I want to have a baby with someone I love. I don't really want to egg freeze. So that's when we have the emotional down.
The cliff.
Yeah. So that's when they get sad after the egg collection and then they come back for an appointment with me. And again, we have counselling in our clinic to offer them counselling if they do get sad after the egg collection.
Why is it so important to have those services? You take a far more hands-on, for want of a better word, approach than many other fertility clinics. Why did you decide to make that choice?
Because I wanted to make egg freezing not medical, Because in the old days, we used to like dress women up in white gowns, walk them down corridors to go into the theatre to, have their eggs frozen. My clinic's all pink. Even my theatre's pink. You walk in there and it's all pink. So it's just a beautiful experience. And all the staff that work for me are just gorgeous, and they're gorgeous to the girls when they're waking up. So if they have a bad result, we have beautiful nurses there to hold their hand, and we get our IVF nurses down to see them as well. Because not everyone has that perfect result. Some girls might wake up and only have 3 eggs collected, or some girls might wake up and have no eggs collected. So it is very emotional. For everyone's got a different journey and everyone reacts differently. But we have a great support team around us to help them out.
What happens when it is a bad news?
Yeah, that's very sad. So they have a very urgent appointment with me, and we work out how we can improve their results, like what different medications we can use. Is there something else we can do to improve their outcome? And we do have lots of different drugs and lots of different protocols. So if they do badly on one cycle, we can usually adjust things and so they do better on their next cycle.
When have there been times where you've had to say, this just isn't, it's not going to work?
Yeah, sometimes sadly some girls are in perimenopause and their AMH when we test it might be less than 1, and they are very hard to treat because they might only get 1 or 2 eggs out if they're lucky. Sometimes 0. So sometimes we do have to have conversations with our patients that they might need donor egg.
It'd be that fine line as well, right? Because it's like you want to do everything you can for them, but then you have to be realistic about chances too.
That's right. We want to be realistic, and we don't want them just doing cycle after cycle when we know it's not going to work. So I tend to be very honest with my patients and say, I'm sorry, this is really not going to work for you. But fortunately, that doesn't happen very often.
Well, let's talk about that flip side then. Because if that can happen, obviously there's times where you have great news.
Yeah.
What does that feel like for you?
The girls are usually come back for their appointment after their egg collection, and they're really stoked about their results and really happy. They got their 15 eggs, and they often want to do it again because they feel very empowered by their 15 eggs. And there's little calculators you can get now online that will calculate, what does 15 eggs mean? Does that mean a baby? That means probably about an 80% chance of a baby. So everyone's aiming for that 95%. So most girls will do their egg freezing twice.
Really? So 15 eggs
gives you about an 80% chance of 1 baby. 20 eggs will give you a 95% chance of 1 baby. So that's why most girls will aim for that magical 20. Some girls aim for the magical 30.
And if it is under the 8?
Then they often need to do it again.
Okay.
Yeah.
Okay. How much does all of this cost?
So our clinic was, when I started my clinic back in 2018, I came out with an amazing price of $2,500 for egg freezing. So we're sort of around that price still. We haven't really gone up in our prices. So it's not covered by the government mostly. So you can be medical egg freeze, where you've got something like endometriosis, polycystic ovaries, or low ovarian reserve, low AMH. They're medical. But if you're non-medical elective, you have to pay for your own medication, which can be up to $2,000, then pay for the expense of the actual egg freezing as well. So it can be expensive if you aren't deemed to be medical.
And then I guess the next step of that is the IVF, if that's necessary.
Yes.
So how much would that process be?
Then you've got to fertilise the eggs, so you've got to utilise technology. Technology is not cheap, so when we fertilise the eggs, we have to do a procedure called ICSI, where we put the sperm into each egg, because the eggs are quite tough after they've been frozen. So we have to use ICSI. We have to have clever scientists doing that. So that process is a bit more expensive, but it's still cheaper than an IVF cycle. It's around $3,500. An IVF cycle is about $4,500. So it's not as expensive as a full IVF cycle.
Okay. So in my head, you're just in a lab coat, you've got the goggles on, and you're creating life essentially. Is that how you see your own facilities, your own clinics?
Yeah, and I think, I think my staff, I've got amazing staff behind me. So it takes a village to make a baby, and that's basically what we've got. We've got a village at Number One Fertility, and we all work together, and we're all of the same mindset. I've got a beautiful team behind me. They are very caring and loving towards the patient. And it's not just about me, because I can't do everything. I don't fertilise the eggs. I rely on my lovely scientists to do that. So, I've got this village of people all working towards the one thing to help people have babies and freeze their eggs.
I read a quote from you somewhere that said that the IVF industry in particular was making women feel sick, and they're not sick women. Do you think that that's still the case?
I think it's improving, and I think that was my vision when I left my previous corporate fertility centre. I had a vision that I wanted to make my clinics more like you're walking into a hotel or a boutique spa experience. And so that's sort of what I did. And as I've done that, you can see other clinics following in suit. So it's great that, women can walk into beautiful centres, not feel like it's sterile, not get dressed up in white robes anymore and, put into theatre and have time to have their embryo transfer, not be rushed out of the clinic because they've got the next patient on that needs to have her transfer. So, yeah, that's why I feel like, you're not sick when you're trying to have a baby. It's not an illness. It's not an illness when you're trying to egg freeze. So that's why I tried to take the illness side out of medicine and create like a beautiful, luxurious clinic.
Talk to me about what we can be doing right now, today, every woman listening, to better improve our fertility.
Yeah, so I think you've got to start improving your fertility from your teenage years. So, yeah, so you've got to take note of your gynecology symptoms. If you feel like there's something wrong, then you need to see a doctor that's going to listen to you and investigate what might be wrong. So even from a teenage year, and I think it should be educated at school about our egg banks and how our, cycles might be our different cycles might affect our gynecology. And we should talk about, our fertility future in schools rather than telling people you shouldn't get pregnant on the pill, use condoms. We should be talking about their reproductive potential, even from teenage years. And then in our 20s, there are things that you can do to look after your health. So no smoking, limit your alcohol, exercise regularly, eat healthy. Mediterranean diet is the best diet to follow right through your life, and that's been proven. And then, look after your future fertility and be as healthy as you can in your 20s. And then if you're still not ready to have babies, then start looking at your egg bank test and start getting that checked with your GP can do that. And even if your GP tries to talk you out of it, just be persistent or find someone that will test it for you.
See, that's what I need to do. I need to go get mine tested immediately.
Exactly. I'll send you a slip.
How can stress affect someone's fertility? Or does it?
Yeah, it does. So for instance, if we have a patient with breast cancer and she has to freeze her eggs before she goes into breast cancer treatment, often her response to the medication isn't very good. So they sometimes do get lower eggs, and I'm sure it's got to do with all the stress and the anxiety of being newly diagnosed with breast cancer. So stress does affect your fertility. It increases your risk of miscarrying, and it lowers your chance of getting pregnant even when you're doing normal IVF without even the background of cancer.
What about acupuncture? I know a couple of my girlfriends who use that in tandem with everything else, and they said that helped them. Is that a thing?
Yeah, it lowers your cortisol levels. So it is known to lower your cortisol levels. We think that it does improve the egg numbers that patients get. Unproven though, so we don't know for sure. But there is some evidence on the day of your transfer, if you have acupuncture pre and post, it might improve your pregnancy rate.
Dr. Lynn, you talk so beautifully about educating yourself as early as possible when it comes to your fertility to give yourself the best chance in the future. For teenagers potentially, what should they be looking for? Or even mums, like mums listening to us right now, what do they need to know or look out for when it comes to their daughters at that early stage of life, in case there is something wrong with their fertility they could spot?
Yeah, no, I think it's very important for mums to look out for their daughters. What's going on with their periods? When did their periods start? Are their periods regular? Are they painful? Because if they are painful, most likely you're going to have endometriosis. And so irregular bleeding, irregular periods, things like not getting their periods. Do they have a condition called hypothalamic amenorrhea, where your brain's not signaling to your ovaries properly to cause you to ovulate? So all those tests can be done with a good GP, a family GP, just to check before, say, someone does put them on the pill, just to, I'll put you on the pill, that will fix everything. The pill is a Band-Aid. So investigate first, then the pill is a good treatment for most things, but it is a Band-Aid and things need to be investigated first.
How do recommend having those conversations? Because, I mean, I know a few teenage girls and I know myself as a teenager, and I loathed talking about my period with anyone, especially my mum.
Yeah, I think that most teenagers will talk to their girlfriends. I know with my daughter, she's very open and talks to me about her periods and things, and so will all of her friends. Maybe because I'm a fertility doctor, I know everyone's story. But I think you should be open and honest with your daughter, and you know when your daughter's got her period, because like usually a bit grumpy around that time. We get a bit grumpy, so mums do know, and I think it's very important to check up on your daughter that their periods are okay, they're regular, and they're not painful.
When should we start thinking about freezing our eggs?
Well, we should start in our 20s, really. Yeah, in your 20s. So remember, your eggs decline from 24. So I think even at 25, you get your AMH checked. If it's okay, you can probably leave egg freezing for a few more years. But around 28 is kind of getting to the sweet spot where you should be starting to really consider egg freezing.
Wow. And how, if you did it at 28, how does that affect, if, say, compare maybe to if you did it in your mid-30s?
So your egg quality will be much better in 28. So you'll have less chromosome problems at the age of 28 compared to a 35-year-old egg. So less chromosome problems. Also, you'll have more eggs as well. So you might only have to do 1 egg collection rather than 2 egg collections at 35.
Why do you think that you've chosen to have your clinics, have your work, present it in this kind of way, choose this path rather than the more clinical, sterile route of traditional IVF practices?
Well, when you're suffering from infertility, you're not sick. It's not like you've got, something wrong with your bowel or you need to have an operation to get your bowel fixed up. So you're not actually a sick person. You're not going into hospital because you're unwell. You're going into hospital for an elective reason to have a baby. It's not that you're sick from your fertility disease. So we've got to stop treating people as sick patients and making the experience much more enjoyable, holistic as well, and look after their whole mental health and body health during the process.
That would make me feel far more comfortable, seeing it as an experience rather than having something happen to me, because I feel like it's such a scary moment. It's such a vulnerable moment. Pretend I've walked into your amazing clinic, pink everywhere, we know this. What would my day look like? How would the experience unfold?
So the traditional IVF industry just looks like, you're walking into a white wall clinic sitting on uncomfortable chairs. But I want my women to feel empowered when they walk into my clinic, and I want them to have a beautiful, holistic experience right the way through their journey to the end of their egg collection and to the end of their transfer, and even when they become pregnant. You would be offered tea, coffee, herbal tea, anything, water from our lovely staff, and then you would be brought in with a nurse to see me. I always have a nurse in the appointments with me, and so we chat to you and just have an informal chat. We take history from you, and then after the appointment with me, you get to spend some more time with the fertility nurse, and then you're followed up with phone calls from counsellors, nursing team again, and even our embryology team will call you as well.
Wow. Okay. So you are far more hands-on than I think I would assume a doctor would be.
Yeah, definitely. Women often have problems with fertility because they feel they're letting their partner down. Like, if I wasn't infertile, you could have a baby with someone else, or if I wasn't so old, you could meet someone younger. So I try and break that stigma around fertility treatment and just try and create a really beautiful environment, very nurturing and holistic environment for all the patients.
Because they're not sick.
No, they're not sick at all. They're just women wanting to have babies or freeze their eggs.
Do you think that's a common thread, that torture? We
Yeah,
torture
we
ourselves.
always blame ourselves, and the men, we never blame the men, even when their sperm may not be very good. It's always about the woman.
Yes. How often is it actually the men?
Yeah, so 40% of the time will be male factor, 40% of the time will be female factor, and 20% of the time both. So it's really half-half, 50-50.
Does it ever get old for you seeing people, they get that positive pregnancy test?
No, it's lovely. It's the best job in the world. Like, really. I sort of think, how did I choose this form of medicine? And I'm so lucky I fell on my feet, and I have a talent for it as well.
And I hope you don't mind me saying this, Dr. Lynn, but for all of our listeners, you look incredible. You're so well presented. You're absolutely beautiful. Before I let you leave the studio, It's been quite distracting seeing your incredible shoes, like look at me this whole time. And I was wondering, would you mind possibly showing everyone as well, all of our cameras here? Because not only do you create life and you're one of the smartest people I've ever met, the talent for wearing the biggest shoes I may have ever seen.
Know. And I've done lots of cesarean sections in shoes like this. So
You've done C-sections in this?
I have.
What?
Yes.
Okay, stand up. Let's have a look. Why do you like high heels?
I feel like they give you power. And I grew up in medicine working in a very male-dominated area. So it was always good when I could look eye to eye to them. Yeah.
Yeah, okay. It was a power game.
Yeah.
Love that.
Yeah, I like being empowered by looking a man in the eye.
Dr. Lynn, for the woman who's listening to this episode, who's going to listen to our chat, what do you hope that they take away?
I want them to look after their reproductive health and their future baby that they're going to have from their eggs. Get your AMH checked. It's a simple blood test. It costs around $80. Not that expensive. And if it does come back low or high and you don't know what to do after that, come and see someone like me. Not to ignore symptoms. Just don't go and see the doctor and they write that script for the pill. Get investigated.
I feel like the message is do it before it's too late.
That's right. Do it before you find out your AMH is 1.
Yes, because I feel like there's lots of platitudes and things that you can say, like, oh, it's never too late. It's never too late to do this. It seems to me that fertility is actually one of the areas where it could be.
Well, I think all women need to have an early understanding of their reproductive health and look after their reproductive future.
Dr. Lynn, where can we find you? Like, where is the best way to find your resources? Where can we find you online?
So I have my own website, Dr. Lynn Burmeister, and also we have Number One Fertility, our website there, so people can find me there.
Well, I'm off to buy myself some high heels. I'll see if my feet can actually survive. But Dr. Lynn, thank you so much for joining us on Fernwood Unfiltered.
Thank you, Georgie.
And if you've enjoyed this conversation and learnt almost as much as I have, make sure you share it with someone who needs to hear it right now. Fertility is such an important issue. We don't talk about it enough. And I think it has the opportunity to be really empowering, but we don't treat it that way. Until next time, see you then.